We were taught this in paramedic school, right? That patients with pulmonary embolism present with chest pain. In fact, they taught us we can differentiate between cardiac chest pain and pain associated with pulmonary embolism, because patients with cardiac chest pain will say, it just hurts. It's like this pressure right here. Where patients with pulmonary embolism will go, it hurts right here. But how often does pulmonary embolism actually present with chest pain? There's not a lot of good data out there. What I found is that it's somewhere between 39 and 84%. And with all that real estate in between, that means that it's actually not a great indicator. This paper looked at the clinical presentation of patients with confirmed pulmonary embolism in 2 clinical settings, so the data is actually broken up between the 2 settings. The most frequently reported symptom was a sudden onset of dyspnea that occurred in 78 and 81% of patients. Chest pain was the second most common reported symptom, and that was only in 39 and 56% of patients. Below that, we have syncope and hemoptysis, which is coughing up blood. So if this paper is to be believed, you are possibly more likely to not see chest pain than you are with pulmonary embolism. The takeaway here is that you shouldn't be looking for just one thing to confirm your suspicion of pulmonary embolism in your differential diagnosis. What's wild is that in 20 years, I have never had a patient where I suspected pulmonary embolism or found out later it was pulmonary embolism where the patient reported chest pain. Link to that paper in my bio.